Hi everyone, my name is Joshua Perez, and the topic that I'll be discussing today is HIV prevention. All right, so a little about me. I'm an MSW graduate student studying social work with a clinical concentration. I'm currently interning at Optimus Healthcare as a clinical social worker, maintaining a caseload of clients and doing their therapy work. My research interests include HIV prevention, childhood development, and therapy modalities, such as CBT, DBT, and stuff like that. And then some future career interests include therapy, becoming a counselor, or even a school social worker. So let's get into it. So, HIV basics. What is HIV? So, immunodeficiency virus, HIV, is a virus that attacks the body's immune system. AIDS occurs at the final stage of infection if left untreated. How can HIV be transmitted? HIV is spread through bodily fluids such as blood, semen, breast milk, and vaginal fluids. And what are the common symptoms? So, fever, headache, rashes, swollen lymph nodes, and sudden weight loss are all common symptoms associated with HIV. Okay, so let's go into the risk factors, which means like the risky actions that people take that increase their chances of contracting something. So for this, it'll be HIV. So MSM, which stands for men having sex with men. That's a at-risk demographic group. Having anal, vaginal sex without a condom, sharing contaminated needles, and having multiple or anonymous sex partners are all ways that your chances of contracting HIV increase significantly. And then what are some common misconceptions? So HIV is spread by kisses, hugs, or sharing food. That's absolutely false. And HIV can only impact certain groups of people. Also false. It can impact anyone. Anyone can get HIV. All right. So how often should I get tested? So I'm going to focus on gay and bisexual men for this presentation, primarily because they are the demographic that's at most risk. But again, anyone can contract HIV. But for the purposes of this presentation, I'll be focusing on this demographic. So sexually active gay and bisexual men should get tested for HIV at least annually. And those at higher risk, so those that have multiple partners, anonymous partners, may benefit from more frequent testing, so about every 3 to 6 months. And then what age group is at highest risk? So in the year 2022, the largest number of infections occurred from the age group between 25 to 34. And then the second largest age group is 13 to 24. And this information comes from the CDC, hv.gov, um, the WHO, like those are all like really good sources if you want to get more information. So HIV prevention, how can I protect myself? So now that we talked about the ways in which you can contract it and the risk factors, now I'm going to discuss how we can prevent it from happening. All right. So PrEP. This is a medication that I've been talking about for a while because a lot of my research is around this. PrEP is a medication that is typically taken daily to prevent HIV infection with a 99% efficacy rate, which is really high. And it's typically geared towards gay bisexual men, which is the highest risk demographic, as I've mentioned previously. And then we have doxypep. Now, this is an antibiotic. This is fairly new, and it can be taken within 24 to 72 hours after condomless sex to prevent STI infections, including syphilis, chlamydia, and gonorrhea. And the efficacy rate of that is about 80%. Right. And then wearing a condom, of course, avoid sharing needles. So doing the opposite of what the risk factors are, basically. And is there a cure? Unfortunately, a cure has not been found yet, which is crazy. But with the current medications available, HIV positive individuals can remain undetectable. And then you could always talk to your healthcare provider for more information. So here's the link. Let me click on it. Take us here. Let's see if it loads. Ah, here we go. So this is the website, Q Care, Easy Online Prep. You just click that. Um, and yeah, this gives you more information about PrEP and DoxyPEP, if it's right for you. And yeah, it's very convenient. All right, so let's go back here. All right. Oops. All right, next slide. So, the Ryan White HIV/AIDS program. So, this agency provides HIV primary medical care, medications, preventative measures, and essential support service. So, this Ryan White HIV/AIDS program is actually also located at Optimus Healthcare, which is at my placement. And they primarily serve patients who are diagnosed with HIV. So this is their homepage. And if you click here, it'll bring you to additional testing locations. Yeah, these are all like within Bridgeport. But if you live in a different area, you could always change that search. Um, All right. So now let's talk about the discriminatory practices. Now, a lot of my research also focuses on minority populations and their impact with the HIV crisis. So unfortunately, minority populations are at greatest risk for contracting HIV, and this has to do with a dual discriminatory forces such as racism and heterosexism. And that falls into the intersectionality, which is the intersecting identities. So if you have multiple identities that may be prone to discrimination, such as, being a person of color, being a part of the LGBTQ community, and other marginalized identities, it falls in that intersectionality because it's like a double force, if that makes sense. So within heterosexism, there's shame and stigma associated with HIV and the LGBTQ plus community because HIV has been known as like the gay disease, and therefore there's a lot of stigma surrounding it. And also there's just a general lack of LGBTQ plus sex education available in schools. And then, of course, structural racism. So the whole systemic forces, policies, institutions, systems that benefit white people over minorities also applies to the HIV epidemic because due to limited access to healthcare, lack of education regarding safe sex practices, low income, so uninsured populations or those that are low income have more difficulty accessing preventative medications such as PrEP, DoxyPEP, and if they do have HIV, they probably wouldn't know because they most likely wouldn't get tested or yeah. And then there's also language barriers to consider. Um, So cultural considerations. So there's again stigmas around the HIV and LGBTQ plus community, but there's also that stigma that exists within the Hispanic and Black populations. So not only is there stigma outside of the minority population, there's also that stigma that exists within those populations. That's why it's harder for gay men to come out in Hispanic and Black families because they tend to be unaccepting. Generally, I'm not speaking for everyone, just a general statement. And then language barriers and the ability to understand healthcare providers is also an issue. We need more, bilingual staff. And then mistrust in the medical field due to historical trauma. So there's a lot of that medical mistrust because of past occurrences and things that happened, and even currently, that's unfair to Black and Hispanic families. And then policies to consider. So the Affordable Care Act comes to mind, specifically Section 1557, which protects LGBTQ plus people from discrimination in healthcare. And then as of 2021, all insurances must accept PrEP. And because it fell under the Affordable Care Act, because it's considered a preventative service, that means that PrEP is covered by most health insurance plans without any out-of-pocket costs. And the Affordable Care Act made PrEP free under most health insurance plans and expanded Medicaid coverage for more people. This includes private health insurance, state Medicaid, and some traditional Medicaid programs. Even without insurance, there are still ways to receive PrEP without any out-of-pocket costs. And that link that I showed you previously, where you could access that online prep, it did preface on the website that there's ways to still access it through grants, through funding that could help that can help people who don't have insurance and can't afford the PrEP medication. And then the U.S. Department of Health and Human Services, the HHS, offers this program, which provides PrEP at no cost to eligible people without prescription drug coverage. And then thanks to the ACA, no American can ever again be dropped or denied coverage because of a pre-existing health condition like asthma, cancer, HIV, or COVID-19. And then our current political administration, so this is a little concerning. This comes straight from a survey description. Congressional leaders are actively considering proposals that would deeply cut Medicaid, endangering the health of millions of Americans. The House and Senate are beginning to work on major legislation that would provide tax cuts, disproportionately benefiting the wealthiest, and to pay for those tax cuts, they are targeting cuts to Medicaid and other vital health programs. And additionally, the Trump administration is considering cutting and possibly eliminating HIV programs and funding to support HIV prevention research. So, a lot of what I discussed in the previous slide may be at risk due to this current political administration. This is just something to think about as we head towards the future. And then here's a petition. I'll click it to show you guys what it looks like. Um, Basically, to protect Medicaid from cuts. It explains what I just described. We already got 2,819 supporters. You just got to put your name, email address, all that good stuff. And then it creates this letter template for you, and then you send it over. And yeah, it's a great way if you want to protect Medicaid. All right, and then here's my intervention. So I've been working on a capstone project, which is basically any topic you want that helps to eliminate a social justice issue or at least like lessen the effects of it. So my topic is HIV. And so my intervention was creating a pamphlet, which is actually printed now and ready to be distributed. But this is kind of like the online version since I made it through Canva. And this basically provides you what HIV is, how to prevent yourself from contracting it, common myths, the current political situation. So basically everything I said in the slides, but in a condensed version. So yeah, this is what it looks like, a couple statistics, and then a couple QR codes just to access the survey and that website for the PrEP and DoxyPEP. And then here's some hotline contacts. So we have 988 Lifeline, to speak with a trained crisis counselor. The crisis text line, text home to 741-741 for free confidential 24/7 support. And then always for LGBTQ plus crisis support, you can call the Trevor Project at 1-866-488-7386 or text START to 678-678 to chat online. And yeah, these are great resources. And yeah, these are my references. So thank you guys so much for listening. And I really hope you guys can take some new information out of this. Have a great day, everyone. Bye.